Oncology rehabilitation describes a wide range of therapies designed to help you build strength and endurance and regain independence. Here to talk about the different varieties and benefits of oncology rehabilitation is Dr. Mann, Hematologist Oncologist with Baptist Medical Group. Good morning, Dr. Mann. Thank you for joining us.
Well, thank you for having me, Rachel. It's a pleasure to be here with you and your crew to talk with you and your audience.
Well, thank you. And to get us started, we want to know about you. Tell us how you got into hematology oncology.
Well,
if I can even get it out of my mouth, that's important.
I have been a hematologist and oncologist in this area since 1997. I've worked at Baptist Medical Group now, presently, and I came from the University of Florida, and that's where I got my first training.
Go Gators!
Yes, go Gators. But I think, over the past 20 years, it's important to know that there's been so many advances in oncology. I think we've all seen that, all of us involved in cancer care. Just better detections, better screenings, earlier detections, better treatments, especially with now the newer molecular profiling of cancers and the more individualized targets, and actually better supportive care with the development of survivorship plans and programs like the Cancer Rehab Program.
Well, you mentioned cancer rehab. How many different kinds of cancer rehab are there?
Well, let's talk about survivors first, because there are many different types of cancers, many different types of survivors to cancers. And so really for a program to be truly personalized and individualized, it has to take on many forms. But the consensus guidelines stress these 8 factors that are common among all cancer patients: anxiety and depression, cognitive decline, or what we call chemo brain, pain, sexual dysfunction, immunization and the prevention of infection, fatigue, sleep disorders, and exercise. In fact, only 10% of patients exercise while they're on treatments like chemotherapy, and perhaps only 20 to 30% get appropriate exercise after their treatments are done.
Oh, wow. So what is the most common or most referred to?
Well, the most common through the nation is probably breast cancer for women and prostate cancer for men. But your audience would probably be interested to know that 45% of all patients in these programs are over the age of 70. But let me say 2 things, if I could. These are summary statements from recently published articles regarding those 2 cancers, breast cancer and prostate cancer. With breast cancer, an analysis of 6 prospective studies that included over 12,000 breast cancer survivors showed that physical activity after diagnosis was associated with a 24% lower risk of breast cancer recurrence.
Oh, wow.
Now, also with prostate cancer, men who are engaged in at least 3 hours per week of vigorous activity had a 61% reduction in prostate cancer-related deaths. And this is probably true for all cancers, perhaps. There are certainly articles on uterine cancer, ovarian cancer, cervical cancer, colon cancer, rectal cancer, liver cancer, esophageal cancer, multiple myeloma, lymphoma, and perhaps all. That a good exercise program after the diagnosis will not just improve your overall health, your quality of life, but actually decrease the risk of recurrence and improve your survival from that cancer.
Well, and you kind of explained a little bit the benefits of rehabilitation, but so why aren't folks who have been through the cancer process and chemo, why aren't they getting the exercise they need? What's the fear?
Well, this is the benefit of this program that we're forming at Baptist Hospital. It's open to all cancer patients. And what we do is our team will take each patient and introduce them to a structured and organized exercise program to get each patient on their way. Each patient has its own unique features, and our team, irregardless of age, irregardless of ability, will help put together a program that each patient will have success with. Baptist is really at a unique opportunity because it has a superb team of physical therapists, occupational therapists, dietitians, nutritionists, spiritual counselors, financial counselors. We have everybody at our disposal to be used so that each patient can have their successful survivorship plan.
Good. So when you are trying to determine what kind of rehabilitation the patient needs, what is that process?
Well, each patient will have their chart reviewed. our team of professionals will look at the list of medications, look at the patient's abilities, look at the patient's likes and dislikes, and then also they'll look at what cancer that person had, because each cancer has its own set of circumstances. For instance, lymphedema might be important to the breast cancer survivor. So we'll have our lymphedema experts look at the program and help design lymphedema modifying treatments and interactions. And then we'll look at the types of chemotherapy or radiation therapy each person received in their treatment, because each chemotherapy has its own set of side effects. Some maybe more with fatigue, some more with neuropathy. And with all this information, our team will help put together a personalized, individualized plan that will help each person have a successful cancer survivorship.
So when should a patient seek out some rehabilitation services?
Well, each patient at the day of diagnosis is considered a survivor of cancer. So really any time is appropriate, whether it's during treatment, whether it's after treatment. But a lot of us think that during treatment is the best time. If you can improve your overall health, it stands to reason that you should improve your tolerance of the treatment that you're receiving. And a lot of us actually believe that earlier interventions like physical therapy can help lessen some of the side effects of treatment, especially fatigue. But I think our thoughts really are that no one should be left out. There's just too many benefits regarding not just quality of life, but also important treatment. That is, again, lessening recurrences and improving survival.
Well, is there anything you'd like to share with our viewers maybe that I haven't asked about cancer rehab?
Well, again, it's a program that we're developing at Baptist that is looking at each patient individually, looking at the disease they had been diagnosed with, the treatment they received, and with our group of many different departments coming together, designing a program that's unique and specific to each patient.
Well, and if someone wants more information, what resources are available? Where can they call?
Well, there's many different departments, many different people involved, many different locations. We have locations at Baptist downtown, Gulf Breeze Hospital, and the Andrews Institute, Baptist Medical Park, Milton, Crestview. There's many people involved, but perhaps the best number to get a hold of is my office at 850-469-7975, or visit the Baptist website at baptistmedicalgroup.org.
Great. Well, thank you so much. This is fantastic information that I know will benefit a lot of people. We really appreciate you coming on the show this morning.
Thank you, Rachel. Thank you.